Nurses are driven by ethics, and it's in our ethical code to do what's right for the greater good.
We care for our patients from a holistic perspective, and that includes being mindful about the communities that they come from, including their family, as well as geographically.
And that's why climate change is so important to nurses because we know that although it's considered a grand scheme, we're already seeing it locally and we're already seeing the impacts.
I saw how climate change impacts every aspect of health. And if we don't address mitigation and adaptation, there are going to be dire consequences, especially for some of the most vulnerable populations and the populations who are least contributing to climate change. I honestly can't remember when I first learned about Annie, but when I did, I remember my reaction was complete excitement. This was the first time that I learned that there were other nurses who were passionate about climate change and health, and also just other environmental health topics. The Alliance has a rich body of nurses who work together and who all have specific health interests.
So I was introduced to the Alliance of Nurses for Healthy Environments, and we had this common mindset of how climate change is not happening in the future, it's happening now, and we're seeing it now within our local neighborhoods. And when you're doing this sort of environmental health and environmental justice work, it's holistic. It's not just that we have to think of the tailpipe of what diesel emissions are doing, but we also have to think of where did those diesel emissions come from and how are they being transported and where are they being emitted.
So being a part of this institution has really helped me and support me in my mission to ensure the women's health and gender related population has the most current and up-to-date information when it comes to environmental issues.
This has also been such a great opportunity for me to connect with other community organizers, with other leaders that come from all different backgrounds. And it's very inspiring to hear their journey, what they've been fighting for.
And I think us as nurses, we have a lot of impact that we can do regarding research, education, advocacy, and practice. Regarding research, I think us as nurses can be leaders in developing a rich body of research, demonstrating the consequences of health from climate change and other environmental consequences.